Hi, everybody. We're going to give it another just minute or two here as a lot of people are hopping on before we get started. Hi, Rose. Hi, Abby. Still seeing the numbers heading up, so we're just going to wait another minute or so. Then we'll get started. All right. What do you think, Monica? Should we get going?
Yeah, I think so.
All right. Well, welcome everyone to the University of Michigan Genetic Counseling Program virtual open house. Although we'd love to have each and every one of you here to visit, we're happy to be able to extend this virtual version of our open house tonight. A few logistical things. This is just a Zoom, not a webinar, so please be aware that you do need to keep yourself muted if you have any background noise or just in general. We are expecting quite a few participants, so what we're going to do for questions is try to utilize the chat function as we're going through some slides. So please feel free to put a question in the chat. We will kind of be monitoring it and answering some of them throughout the program. We're also going to pause at different points in our presentation and can take questions from the chat at that time. And then at the end, we'll open it up to question and answer. And during that time, it may be possible to just unmute and have your question. And with that, I think we will get started. Oh, one more quick logistical thing. This is being recorded, just so you're aware. All right, so for the day, for the evening here, we're going to do a presentation that's going to go through an overview of genetic counseling. We're not going to stay there too long because many of you online know what genetic counseling is. So we'll spend most of our time reviewing the genetic counseling program here at University of Michigan. And then we will spend some time discussing admissions for the 2024 cycle. And then throughout all of that, we're going to have students who are going to share their perspective with you and also be available at the end for question and answer. So I'm going to introduce myself and other program leadership and students will introduce themselves as we go along. So I'm Beth Dugan. I'm the Associate Program Director here with the U of M program. I've been involved in the program for many years as a supervisor when I was a clinical genetic counselor and an instructor of the reproductive genetics course. And then for about 4 years, I've been part of program leadership. I do lots of different things with Monica and Carrie that contribute to the program, but my main hat that I kind of wear is in clinical training. So I'll be part of what I'll be reviewing with you today is clinical training. But first, I'm going to start off just talking about genetic counseling. As most of you know, genetic counseling is really a process of helping people understand and adapt to the medical and psychological and familial implications of genetic contribution of diseases. This is really a process that integrates many different things. It integrates risk assessment, and so that includes interpretation of family and medical histories and review of genetic test results to really think about the chance of a genetic disease or a reoccurrence of a condition in a family. It requires education So we talk to families about inheritance patterns and testing and the pros and cons of different approaches to testing, as well as management of disease and prevention. And then there's the counseling aspect. So that's really training in the psychosocial elements that help us when we're educating patients to promote informed choices and help them understand and adapt to the risks that we're talking about. So when we think about the core skills of a genetic counselor, the ACGC really puts those core skills within 4 domains. So that includes genetic expertise and analysis. So we need a strong foundational knowledge in genetics, as well as that risk assessment piece. Interpersonal, psychosocial, and counseling skills. So those are the things we've been talking about, and how do we talk to people about these different risks and conditions to help them understand how to apply any decisions they make or the future risks into their own personal values. The education piece. So genetic counselors often are educating not just patients, but other healthcare providers about the use of genetic testing or different genetic conditions. And we often work with people from a really wide variety of backgrounds. And so it is important to be able to educate in different ways. And then professional development and practice. And this really has to speak to the fact that genetic counselors are lifelong learners. So it's part of our kind of code of ethics that we will keep abreast to different changing genetic information, and that we're going to continue that throughout our professional careers. Genetic counselors work in a variety of specialty areas. You probably understand that we train as generalists, so our students are exposed to a variety of specialties, and all of our students do get exposure to kind of what we consider the 3 main specialties, which are the majority of, not the majority, the genetic counselors, the most prevalent specialty is cancer, followed by prenatal and then pediatrics. But genetic counselors are found in a lot of subspecialties as well, cardiology and neurology and opthy, and a lot of different specialty areas as genetic testing has grown. Genetic counselors also work in diverse work settings. So obviously here in an academic center, you will also find genetic counselors in private hospitals. You can find genetic counselors in laboratory positions or in patient advocacy roles with nonprofit organizations or in government. So there's a lot of different trajectories a genetic counseling professional like career path can take. Genetic counseling is a growing profession. So this is the U.S. Bureau of Labor Statistics estimates that a 26% growth rate from 2020 to 2030, which is quite a bit higher than other occupations. So this is really a growing profession. And as Monica will talk about later, our students tend to have jobs before they graduate, have jobs lined up before they graduate. All right, so actually I'm going to pause before we give our first student a chance to speak and just see if any questions came up in the chat or if there's any questions yet.
There are no questions in the chat.
All right. I'm assuming that's because a lot of people on the line already know about genetic counseling. So let's get to our first Ask the Student. This is a picture of our students at an orientation event this year where we had dinner and a lovely time outside. And this is Abby. Abby, I'm going to let you introduce yourself when you unmute, but she's going to be telling us a little bit more about what brought her to genetic counseling.
Yeah, thanks, Beth. My name's Abby. I am a first-year genetic counseling student. I did my undergrad at Purdue University, and I'm from Indiana. So what brought me to genetic counseling was it kind of started back in high school. I kind of had a general interest in science. So I was able to take a specific genetics class, which was something new that was offered at my high school, and I really enjoyed it. So kind of when I transitioned into college, I didn't really know what I wanted to do, but I knew it was something science related. And I kind of also had just like a general interest in healthcare, working in healthcare in some aspect, but I didn't really know what that looked like for me. So I knew I didn't really want to work in like nursing or medical school. So I kind of just stumbled across genetic counseling since genetics was something I was generally interested in. And the more I read about it, I kind of became more and more interested in it. So that kind of led me to where I am today. Throughout my college experience, I was able to attend a lot of information sessions about the profession and shadow a few counselors. Um, and then after I graduated from undergrad, I worked as a genetic counseling assistant for a few years. And then I just started in the program back in August. So.
Great. Thank you, Abby. All right, Monica, I'm going to let you take over.
Great. Hold on one second. Let me adjust my view. Hold on. Okay, here I am. Hi, everyone. My name's Monica Marvin, and I am the director of the genetic counseling program at the University of Michigan. And I want to second Beth in terms of welcoming all of you to this open house tonight. We hope you find it really helpful. We really do encourage you to speak up if you have questions along the way. It'll make this more interactive and hopefully helpful for everybody. So again, I'm the program director. I've been a genetic counselor for 29 years, and I've been a genetic counselor at the University of Michigan for 19 of those years. And like many of you, I chose to become a genetic counselor because I really wanted to be able to work with people, stay engaged in science, and have a career that would challenge and excite me. And after 29 years in the field, I'm really happy to say that I still look forward to going to work every day. I still do see patients clinically in the cancer genetics clinic. And I also have the wonderful opportunity and privilege to work with our graduate students within the genetic counseling program. Together with Beth, who you've heard from, and Carrie Branham, who's also pictured here, and you'll hear from her in a little bit as she talks about research. So when I think about the genetic counseling program, I think it's helpful to just start with what our vision is. The vision of our graduate training program is to train genetic counselors that can meet the current challenges and to also help shape the future of genetic counseling and genomic medicine. And as I talk through the next slides, you'll see that we do that through providing what we really consider a very individualized, integrated, and supportive graduate training environment that spans across the classroom, the clinic, and the research domains of the curriculum. So a couple highlights of our genetic counseling program just as we get started. We are a well-established program. So our program was actually established back in 1979. So we are one of the oldest graduate programs in the country. We have a relatively small class size with typically admitting 8 to 10 students per cohort, and that's what we expect to admit again for the upcoming year. Beth, Carrie, and myself really pride ourselves on being accessible to our students, supportive, and really dedicated to each student reaching their career goals within the profession of genetic counseling. I mentioned that we're a well-established program, but that doesn't mean that we're kind of old and stale. We work to always be innovating in terms of how we're teaching and the clinical practice that our students are learning about. So within the classroom, we have used a lot of different active learning techniques and standardized patients and flipped classrooms. So just because we're old does not mean that we are not always growing and evolving. As we talk through the curriculum, we'll also talk about the ways that we're able to really individualize each student's, or let me say that differently, how each student can really individualize what their experience looks like within our graduate program. I think that's something that sets us apart from many other programs. And we also work to build an inclusive and collaborative learning community within our program. And when we talk about the learning community within our program, One thing I think that's important to comment on is how our graduate program, including our faculty, our students, and our staff, are thinking about the important topics of diversity, equity, and inclusion. So this statement here, which you can also find on our website, is meant to really just demonstrate how we are thinking about diversity, equity, and inclusion, both in terms of where we need to grow, and what some of our activities are, both in terms of thinking about our student body, working to have a diverse group of students so that we can have a genetic counseling profession that's more reflective of the patients that we serve. We've also been thinking across our curriculum, making sure that the classroom curriculum is paying attention to important issues related to healthcare disparities, cultural humility, et cetera. Within our research curriculum, many of our students are engaged in scholarly activities and research that relate to healthcare disparities and equity. And again, we see that we have a really important role to play in diversity, equity, and inclusion across the profession of genetic counseling. So what I want to do now is the questions. So I don't know if I should pause now for the questions that are coming up. They're popping up.
If you want to, there's a nice one you could answer.
Okay.
That's a good place to stop and answer it. So Alyssa
Sure.
shared a question noting that 19 years being here at Michigan Medicine is a really nice endorsement. And she asks, what is it about the institution that has made you happy to stay for so long?
That's a great question. And I should point out that I did my undergrad and my graduate training here, and then I moved away and worked at 2 different institutions for 10 years before coming back for these 19 years. So I have kind of some comparison across different settings. I think one thing is that I really enjoy being in a academic community where a lot of the scientific advancements within human genetics are happening like right within our department and right within our institution. So you really feel like, or I really feel like I'm kind of on the cutting edge of what's happening in terms of genetics advances. I also really appreciate the team that I work with clinically. So I mentioned that I work in cancer genetics together with amazing genetic counseling colleagues and amazing physician colleagues, and just feel that as a group, we're able to provide really high quality services to patients. And then I also mentioned that I feel really blessed to be able to work with some great students in the graduate program. I also love Ann Arbor. It's not a huge city. It's a big town. I love sports. I just love everything about the town as well, even though I don't live in Ann Arbor. But so those are some of the things that have allowed me to be happy. Okay. I will move on. Okay, so excuse me. When I think about our curriculum, there's kind of 3 separate pillars of it: the classroom, the clinical, and the research curriculum. And this is true really at any program that you look at. They will have all of these different types of activities. But as you look at different programs, I encourage you to look at how the different activities are kind of structured and in relation to each other. At the University of Michigan, our classroom, clinical, and research activities are all happening concurrently across the full 2 years of training. Our students get started in clinic the first or the second week that they're with us, which we think is really effective as they're learning things in the classroom, seeing them play out in clinic, discussing them together with faculty and peer supervision, and it builds kind of semester by semester. Actually, Beth, can you go to the next slide, which I think shows us a little bit as well. So what you're looking at here, the first 4 rows in blue there are the classes that our students take during their time with us. And the way this is also organized is by semester. So there are 4 academic semesters when the students are taking classes and also participating in research and clinic, and then the summer in between, where they're not in classes, but are involved in clinic and research. So again, the first 4 rows describe different courses that our students take. The human genetics courses are taken together with other graduate students from across our medical school, including students in the PhD program. So the human genetics courses are quite rigorous, and our students come out really well prepared in that aspect of their training. We have a number of classes that are really related to genetic counseling skills. More specifically, these are classes that are taken just by the genetic counseling students, and they get more advanced each semester. Those are just for the genetic counseling students, although also in that row, you'll see that there's a class called Death, Loss, and Grief that's taken during the second year. That's taken together with mostly social work students, but also students from a couple of other disciplines as well. We then also have a number of classes that are focused on specific topics in medical genetics. You can see the titles of those there. And then a number of other courses, including anatomy and embryology. And one way that our students are able to individualize their classroom training is the ability to take electives. So our students can take electives, they do take electives every semester other than the first semester. And the University of Michigan is a huge university. So there's lots of opportunities out there. Many of the electives that our students take are in the School of Public Health. Sometimes they take electives in the School of Social Work. A couple students right now are taking an elective over in the business school. So there's all sorts of interesting options available. And again, students are able to choose electives that align with what their interests are. Sometimes they align with what their research project is about. A lot of different factors that can go into that. I think so Beth will talk more about clinic and Carrie will talk more about research. So yeah, that's good to go ahead. Thank you. So I think I've mentioned most of this already, but we do feel like regardless of the topic, the courses are being taught by really experts in the field. So I already mentioned that the human genetics coursework is taken together with other PhD students from across the medical school, and it's taught by really the basic scientists in our department that are moving that science forward. The genetic counseling skills classes are taught by experienced genetic counselors, and a lot of it is taught from the book, A Guide to Genetic Counseling, which is actually edited by faculty members here at the University of Michigan, many of whom still teach within our genetic counseling skills classes. And then the medical genetics courses are taught by both genetic counselors as well as physicians from our large academic medical center. And then depending on what the electives are that students take, they're learning from other individuals and other disciplines, which I think really both strengthens their experiences, having that interdisciplinary input coming into their training. And I also think it helps to have genetic counseling students kind of as ambassadors for the profession out in these other disciplines, kind of spreading the word about the important work that we do in clinical care and policy, et cetera.
All right. Do you want to pause for a moment?
Yeah,
I don't see any
anybody...
questions in the chat, but does anybody have a question for Monica before we switch gears from the coursework? All right.
Okay, thanks.
All right. We'll have time for questions later as well, but I am going to jump into talking to you a little bit about clinical training. Similarly to the last chart, we've got your semesters of training across the top here. So the 2 semesters, fall and winter of year 1, and then summer, and then fall and winter of year 2. And this is a layout of the progression of clinical training. And so, like Monica said, we start you in clinical training right away. So within your first semester, you're doing clinical training, but it does, if you look across this first row, format, you'll see that in the fall, we start with observation. If you look at expectations, this rotation is all about active observations. So you're not taking on roles yet, but the goal of this rotation is to get you really varied exposure to different clinical settings, different specialties, different counseling styles. So during that semester, you're rotating through a different clinic each week, and you're observing. So it's a little bit different than like shadowing, where maybe you were thinking like, oh, is this the right profession for me? This is much, much more engaged, active observation, where you're really starting to deepen your understanding of the roles of a genetic counselor. And then clinical training basically progresses gradually from there. So I think it's really important to say, like, it doesn't look the same for any two students. We're not a cookie cutter program where everyone goes through the same sites. So clinical training really does look different for each of our students. The observation rotation in the fall is the most similar for everyone. And then by winter, in the winter of your first year, you spend 10 weeks, usually at one site. And so this is when you're really starting to shift from observation to taking on roles. And the idea here is by being in one clinic with one set of supervisors, you kind of build that trust and start to take on roles as you gain independence as a professional, soon to be professional. Then in the summer, we do clinical training throughout the summer. Monica mentioned you don't sign up for credit hours during the summer, and instead you're really a full-time member of a clinical team. And so during the summer, we do 2 full-time rotations. Usually they're 6 to 7 weeks long, and you are 40 plus hours a week full-time member of the team. Usually one of those 2 summer rotations is here at Michigan Medicine or one of our locally used sites, which I'll tell you what I mean by that. And the other summer rotation is away, which most often means out of state. And I'll talk a little bit more about that. When you come back in the fall, you have a ton of experience because you've just kind of been thrown into genetic counseling and being part of the team and seeing all the behind the scenes things that genetic counselors do. And there's just a ton of growth that happens over the summer. So that when you come back in fall, clinical training is absolutely still continuing both in the classroom as well as clinical rotations. So that usually in the fall of second year, students are completing a 6 to 7 week rotation. But usually it's 1.5-ish days a week, and they're really starting to take on full cases. And then winter of year 2, there's the opportunity to do another traditional kind of rotation, or for some students, there's an opportunity here to do what we call a designer rotation, which I'll talk a little bit more about. But that's kind of, if you look across the expectation lines, you can see how this is a gradual approach. And if you look at this bottom line, support from the program, throughout your training, we have regular mentorship meetings. And so through those mentorship meetings with program leadership, we're really there to help support your clinical growth across all of these semesters. This is a quick snapshot to give you an idea of like caseload for our students. So you can see here on the left, this is a snapshot for the class of 2024, the cases that they were able to see just during their observation rotation. And so for the class of 2024 last fall, they were able to go through 13 different sites across 10 different dates. I should say they all saw clinics on 10 different dates, and we utilized 13 different sites. And on average, they obtained 36 cases. So they were able to observe in 36 cases across the fall semester. And then on the right side of your screen is for the class of 2023, their total summary of clinical cases. And they saw on average per student 175 cases across training. 97 of those were participatory. I can share details on what a participatory case is and all of that, but the main idea is you have some ownership of that case, and you need, by ACGC requirements, 50 for graduation, and our students get well above that. And then the little colorful pie chart just gives you an idea of the specialty areas that these cases came from. And so not surprisingly, we have a predominance of cancer, peds, and prenatal because everybody does those rotations. And then we also have students that spent time in general adult, neurology, ophthy, cardio. All right. So we're really lucky at Michigan Medicine to have a great community of genetic counselors and genetic counseling supervisors. Monica's story kind of illustrated like the commitment of our counselors in being part of a large academic center. So many of our practicing genetic counselors are really excited to supervise students and really feel invested in the student's success. So we have, you can see listed here, 2, 3, 4, 5, 6 clinics across Michigan Medicine, but within each of those, there's also several sub-clinics. So for example, the disorders or the differences of sex development, DSD clinic is within the Peds Genetics Clinic, but it runs like its own clinic. So we really do take advantage of this, and our students enjoy rotations here at Michigan Medicine. We do also use, as I mentioned before, kind of our locally used non-U of M sites. And so that includes Henry Ford Hospital or Corewell Health in Royal Oak, and Detroit, and Toledo is the other one. So ProMedica Flower Cancer Hospital in Toledo. And so by utilizing those sites, we really help our students gain exposure to a different patient population, a different hospital setting. It kind of expands your exposure outside of just like a large academic institution. And so the larger map here of the United States just gives you an idea of some places our students have rotated in the summer. The summer away is kind of a unique rotation in that students can kind of help decide where they want to rotate. So it's kind of a student-initiated, student-led discussion about what opportunities exist and what you want to get out of the summer. So this is another way the program can be kind of personalized. Sometimes that's driven by where a student thinks they might want to work, or a unique patient population, or a specialty they want to dive into in that full-time rotation. And program leadership helps with all sorts of agreements and other things that have to be done. So it's a joint effort, but it is meant to be kind of student-led. All right, so some just quick other points about our clinical training. Our students do get exposure to a variety of service delivery models. So most genetic counselors now do work in a variety of settings, including in person or video or telephone. And so we do try to get our students exposure to those different models. We do use standardized patients. So we have a series of checkpoints with actors who've been given kind of a situation to let you try some things, and lets program leadership see your clinical skills and discuss them with you. And then I mentioned designer rotations, and this is something I'm happy to talk more about if people have questions, but designer rotation is kind of what it sounds like, which is it's really a time for students to help design their curriculum for their final rotation. And so this is for students who have been able to kind of demonstrate the competencies they need in a traditional setting. This is an opportunity for them to kind of expand into an area of interest. So it could be a deep dive into a specialty. It could be a question that they have, and they take the lead in designing the curriculum for that rotation, with program leadership helping with identifying activities and things like that. So that's another way that your education can be kind of personalized. And then finally, laboratory exposure and opportunities. So all students kind of get a core base exposure to the laboratory setting, as well as genetic counseling roles in industry. And then for students who are interested for more beyond that, we try to have opportunities available or match them up with opportunities as they're available. All right. So that is kind of the end of the clinical training portion. Before I hand the mic over to Carrie, does anybody have any questions about clinical training? Well,
There's a question here.
Let me see one. Let's see. How are the semester clinical rotations determined? Are they randomly assigned or based on student interest? Yeah, that's a great question. So the summer away rotation is really led by student interest. Again, it's usually kind of iterative process of a lot of discussions about like what your goals are for the summer. Is it location driven? Is it specialty driven? And then we help identify places. So that one is more student kind of initiated and led with a lot of support from program leadership. All of the other semesters or all of the other clinical training assignments are more assigned, but we do listen to students, hear your preference. So if someone said to me, I really, really wanted to do prenatal as a full-time rotation over the summer, then we take that into account. We try to work within those requests. There's one more question. The opportunity for designer rotation is interesting. Do you have any examples of designer rotations that have been set up in the past? Oh, I have lots of examples. I'll give you two kind of brief ones. Last year, one of our students was interested in really exploring what it means to provide culturally humble care. And so we kind of explored her goals there. And again, this is kind of a process, but in the end, what she was able to do was she observed a lot of cases with interpreter services, and that included ASL cases as well. And then we got her an interview that then turned into a long project with chaplain services. And they were really trying to set up a new service to be advocates for patients when they felt like there was something about their culture or their provider's culture that was inhibiting their care. So sometimes these things start with an idea, and then we talk about it and we tie them into resources, and then students take advantage of what they learn about in an interview, and then that rolls into an entire designer rotation. So that's one example. A very different example is someone who may be really interested in cancer and have diversifying their cancer patients or the patients that they've seen in cancer. And so they may be able to observe more complex cancer cases, go to tumor boards, speak with plastic surgeons, things like that. Yeah, so two very different approaches. Thanks for the questions. All right. If you'd like to unmute, I think, Lydia, did you have another question?
Yes, thank you so much. It's just so much easier to explain.
Yeah.
Going through all that information, Beth. So I met with Emma and Alex from your second year cohort last week on Friday and had a really wonderful conversation with them.
Good.
I am really interested in pursuing leadership in a genetic counseling program in my future. Other programs have for their designer rotations options where you can observe program leadership or get involved in that way. They didn't really know if that was a possibility, but I was just kind of wondering your input on that.
Yeah, I think that's great. You've identified that as an interest so early. So I have kind of two thoughts I'll share. I mean, the designer rotation is meant to have a little bit of a clinical focus. It is a continuation of your clinical training. So we do keep that in mind as we're thinking about your goals and how you want to shape it. That being said, we have lots of opportunity for leadership as well as like interacting with program leadership. So some of our students sit on different committees, for example, like admissions committees, DEI committee, there's roles within the department, and those things build leadership in a way that would help you then get to your overall goal of like maybe program leadership. So I think there's several opportunities, even if it's not necessarily within the context of the designer rotation, to get you exposure that might help you with that goal. Certainly within the designer, we could talk about, different things, different ways that goal could apply.
Okay, thank you so much.
Yeah, absolutely. All right. I think with that, we'll turn it over to Carrie.
So Beth, there was one other question
yeah.
that was someone asking about students pursuing lab industry rotations.
Yeah.
Want to do that now or at the
I
end?
think I answered it in the
Oh,
chat.
yeah, okay.
Okay. Oh, great. Then I'm happy to answer more at the end if there is.
Yeah. No, I see. I missed your response there, Monica. But so my name is Carrie Branham, and I am the assistant program director. This is actually a relatively new position. I just started in August of this year as the assistant program director. Just to give you a little bit more information about my history leading up to now, I've been a genetic counselor at Michigan Medicine for 21 years, so a similar long history like we have with Monica. So and the entire time I've been a genetic counselor in ophthalmology, and I've been involved in research, so a wide variety of different studies. So things like genotype phenotype correlation studies, gene identification studies, none of which I'm doing in the lab. It's all clinical research based. I'm also involved with clinical trials, some epidemiological based research. So I've had a research career, and now in my role as assistant program director, I'm in charge of the research training of the students. So what does a research training look like? Essentially, there is a research skills class that is taught. Some of the people who come into the program will have a lot of experience with research, and some will not have any. And so we try to kind of get everybody on the same page with regard to research training. Throughout that first year of training, I know Beth had kind of showed this on the diagram of what the training overall looks like. Throughout that first year, in addition to taking that research skills class, there is kind of the research topic. It's developed and kind of fleshed out a little bit with what exactly the student wants to do with the research project. And then over the summer and into the second year of training is actually when that project is executed. So a research project is done. The outcome of the research project, there will be a presentation that is given at a seminar here within the Department of Human Genetics. And there is a paper that is written as a part of it. And also the expectation that the student will submit an abstract for National Society of Genetic Counselors or another meeting. So why is the research component of the program important? I think it's twofold. One of them is, as practitioners of clinical medicine, the medicine that is practiced in the field of genetic counseling, it's what we call evidence-based medicine. So basically taking the information that is published in the literature, in the textbook, and using that to work with our patients. So you need to understand the research project process. You need to understand what is in the literature. And so this research program helps to develop those skills in students. And also, you get to take an in-depth look at a topic that you're very interested in and produce information that is valuable for the genetic counseling community. We really try to have this individualized for students. So there'll be a really diverse topics that students will choose. And we really kind of have it, what are your interests? What do you want to do? And what kind of project can be developed within the constraints of the time that you have for the program. So throughout Michigan Medicine, we really have a lot of different great resources, mentors, areas for ideas. So some of it is, there may be someone who's already working on a topic that they'll have an idea with, but a lot of the projects are kind of developed from scratch, and it's a matter of getting the students hooked up with the people who can mentor them. 100% of our graduates have had their research thesis abstract accepted at a national meeting. So maybe the National Society of Genetic Counselors or another meeting. Many of the students have been recipients, including one for this year, of the Jane Engelberg Memorial Fellowship Program. That's through the National Society of Genetic Counselors. And a significant portion of them also have their work published in high impact journals. So if you can go to the next slide, Beth. So what we're showing here is just a number. This is the 2021 graduates. So there's a lot of reading going on there, but really what we're trying to show is just the number of diverse topics that students are exploring. So things like best methods for using telehealth with supervision, newborn screening, risk communication in different populations. So these are all really tailored to what the student interests are, to make it a topic that they're interested in pursuing. Over the years, I would say we've had a lot of topics on a wide range, everything from implementation of genetic counseling services, topics about communication and in different areas. Sometimes it's disease specific, sometimes it will be just kind of on an area that the student's interested, not about a specific disease. There have been other patients who have also done things like develop educational tools. You can go to the next slide, Beth. So this is just an example, and this was kind of a 2-year process. There was a student from the 2021 program who worked on kind of understanding the process of providing gender affirming care in the field of genetic counseling, and then actually developing some tools to help genetic counselors provide more gender affirming care. So this was something that was started by Nicole Hooser in 2021, and then continued on with Gabriel Ernst from the next class. And that is something that we'll sometimes see as well, that students from one cohort of students, a student from the next year's class will kind of continue on and develop that project further. So I think that is it. I'm happy to answer any questions now. If you have them, feel free to put them in the chat, or if you have any.
I don't see any explicitly about research right now.
Yep.
All right.
I think that there was one question that hasn't been answered yet that I can quickly answer from Ethan about lab and industry positions during the fall observations. That's typically not part of what happens in the fall. We're really focusing more on patient-facing clinical roles, because that's mirroring what you're learning about in the classroom during that semester. Certainly, if a student had an interest, we could try to get them in contact with somebody in industry early on in training, but it's not typically part of what's happening in those observations in the fall. Okay, so we just have one slide inserted here to make everybody aware that in addition to our 2-year graduate program in genetic counseling, we also have a 3-year dual degree program in genetic counseling and public health. So that program is one where students usually spend essentially kind of like the first and the third year mostly in the genetic counseling curriculum, and their second year mostly in public health, with a little bit of spillover in all directions. And over the course of those 3 years, our students graduate or earn degrees both in genetic counseling and the master's in public health. Most of the students, but not all, that do this, do their master's in public health within the health behavior and health education department within the School of Public Health. Although we do right now have one student, Liz Hart, who's getting her MPH in health management and policy. If anybody's interested in the dual degree program, we're happy to talk about it more at a separate time, and also to put you in touch with some of our dual degree students. Right now we have Liz, who's doing health management and policy, and then 3 other students who are getting the health behavior, health education degree. Master.
And Amy, who is a dual degree student, will be on later, like for the question and answer. Yeah.
Yeah, I think she has class till 6.
Yeah.
So anyway, we're happy to tell you more about the dual degree program if you have questions. The other thing that I'll mention is that some of the students that are in the dual degree program apply directly to the dual degree program. And when they get admitted to the genetic counseling program, they know that they're going to be in the dual degree program. We have other students who apply as a regular student. They get onto campus, they start taking some classes, and they realize they're also really interested in public health. So you can decide to pursue the dual degree after you're already with us. So right now, Morgan Hurst is in their second year of graduate school, and they didn't decide that they wanted to do the dual degree until they were already here, so applied during the fall of their first year. So that's possible as well. Okay, I think we'll move on. A couple of other just factoids about the genetic counseling program. This is actually a little snapshot of a invitation to last year's graduation party for the class of 2023. That was a smaller class because 3 of their classmates that they started with are actually in the dual degree program. So they're they're still with us this year. But as you're looking across different graduate programs, I think some important metrics to pay attention to are the pass rate on the certification exam. We're super proud of how our students do on the certification exam. Over the last 5 years, there's been a 91% pass rate for first-time test takers for graduates of the University of Michigan Genetic Counseling Program. And that's in comparison to a national average that I didn't relook at it. I think it's somewhere between like 75 and 80% nationally. And the alumni who didn't pass it on the first time passed it on the second time, so 100% total pass rate. Over the last 5 years, all of our students that have started the program have graduated from the program, and all of them, as we said earlier, are placed in jobs and typically placed in jobs before they graduate. And so we're really, really proud of kind of where our students land when they're done with their time with us. So I think now we're going to hand it over for a little bit of input from the students about kind of how they are enjoying their time so far with us.
Yeah, I think Rose is up and she's going to talk a little bit about her favorite thing here within the program.
Hi everyone, my name is Rose and I'm a first-year student and I am originally from Michigan. So it was really hard for me to pick just one thing. So I do have a couple tidbits. But some of my favorite things is how early we get to start our clinical observations and rotations, as well as the discussion of our research project. And then the next thing was really the community feeling. And the program really has built in a support system for its students, both between cohorts and then with leadership as well. So it was really nice to know that I had a support system going into the program.
Great. Thank you, Rose. And Rose and Abby will be here, like I said, at the end for questions too, if you want to hear more from the students. All right, Monica, back to you.
All right. This is the least fun part to talk about, but I know it's super important to understand what the cost of graduate school looks like at the different programs across the country. So let me just start by saying that when we showed the timeline of the graduate program, there's the fall and winter semester, and then summer, and then fall and winter semester of the second year. There's only tuition for 4 semesters, so you don't pay any tuition in the spring or summer when you're doing your clinical training. What I have listed here are what the tuition fees are as set by the university. I think you're probably all aware that we are a state university, so there are different rates for tuition for Michigan residents versus non-Michigan residents. What might not be as apparent to people that aren't familiar with the University of Michigan is that it's very, very, very difficult to transition from being a non-resident to being a Michigan resident. So students who enter the graduate program as out of state or non-Michigan residents will pretty much remain non-residents during their time with us, rather than being able to kind of flip over to being a Michigan resident. And we have no control over that as a graduate program. We recognize that the cost of tuition is quite high, and so we try to defray the costs a little bit. So all of our students do receive a partial tuition stipend each semester that they're with us. The stipend for the non-residents is a little bit higher than what it is for the Michigan residents, again, just because of that difference in what the tuition actually looks like. It's usually a few $1,000s per semester that we're able to provide, but that gets kind of determined each year based on what our budget looks like. And we would certainly let applicants know exactly what that amount would be before you have to rank programs. We know it's important to have transparency about what the costs will look like. There's also a number of competitive fellowships that are available to some applicants based on what your background is. Most years we are able to award one student what's known as a Rackham Merit Award or Rackham Merit Fellowship that covers the cost of tuition and a stipend for a semester. That's reserved for students from specific educational, cultural, geographic, or familial backgrounds. And there are details available through the Rackham website. Rackham is our graduate school that would help you understand if you might be eligible for that. Applicants need to be nominated for that. At the Rackham website, there's a number of other different types of scholarships and fellowships. A lot of them we would need to nominate you for. So usually we ask people when they begin the interviewing process to let us know if they think they might be eligible for any of those. And then finally, at least half of our students have some sort of work that they do to help with their expenses. So many of the students have work study funding and work. We have a couple of genetic counseling students that work for us as a graduate program, helping us with things like this event tonight and our newsletter and other logistics. A number of the genetic counseling students work as genetic counseling assistants in the genetics clinics on campus, which is a really nice opportunity to both be earning money and also supplementing your learning experience. Some students just have part-time jobs at like Starbucks or nothing to do with the University of Michigan. And then finally, we have a couple students who get what are known as graduate student instructorships or GSI positions. These are essentially teaching assistant positions where they are working mostly with undergrad students in different genetics or biology related classes. Those GSI positions are not awarded by our department, so we have no control over who gets them. But if somebody does get a GSI position, that other department actually pays the students tuition and gives them a stipend. So it's very financially lucrative, but also a lot of work. Not all students even choose to apply for a GSI position just because of how much time it does take. But again, we are supportive of students working while they're with us. And I think that question comes up more than I would expect it would, but we are supportive of students having jobs to help with their expenses. Okay. So I'm going to transition now, unless there's a question in the chat related to the finances. No. Okay. So transition to information about applications. So this is what our data looked like from last year. We had
hold on, Monica, I'm going to pause you because some questions just rolled in. So
okay.
Pause for a minute and then so we have 2 questions about the GSI positions. How do you look into and apply for them? And can you participate in a GSI position in your first year?
Okay, I can answer those.
Yeah.
So I'm going to do the second one first. Can you participate in a GSI your first year of GC school? You definitely cannot in the first semester because you don't even know what program you're going to yet when you have to apply for the GSI position. So the timing just does not work at all to be able to be an applicant for a GSI position for the fall of the first year. Technically, I guess you could be a GSI in the second semester of your first year. It's just a very, very challenging semester. And so most of the time, almost all of the time, if a student's going to have a GSI position, it's usually in their second year for either the first and or second semester. Is it possible to do it in the winter of your first year? Yes, it is, but it's would be really quite challenging, and it would be something we would want to talk really carefully with a student about in terms of recognizing kind of the body of work that they'd be taking on. How do you look or apply for GSI positions? You in the semester prior, the departments open up their application and you apply to that other department. So most of our students, although not all, but most of our students have their GSI positions within the biology department. And they have an application process. Most of those departments, you know, their first priority is to place their own PhD students into GSI positions. And then they look to other programs when they need more GSIs. But our students have been awesome GSIs for a lot of the undergraduate courses. So I think that we're pretty attractive in terms of like being recruited for those positions. So I hope that answered that. Okay, so getting into admissions, last year we had about 300 applications. We interviewed 40 people and we admitted or matched with 9 students, which was the goal number that we were looking for. And this year, I don't know how many applicants we'll get. We've been around this 3 mark for a couple of years now, so I'm going to guess it's probably in that ballpark, and we will be interviewing 40 applicants again. And there's lots of different dates out there across lots of different programs. The 2 dates that are coming up are the deadline in December to register for the match. So if you haven't already done that and you know you want to apply for this year, make sure that you register for the match through NMS by December 13th. If you have any questions about that, let us know. And the deadline for submitting your application to the U of M genetic counseling program is January 5th. Since a question came up about this in the chat, I'll just say it explicitly. We do have 3 different graduate programs within the Department of Human Genetics. One of them is the PhD program. One of them is a master's in human genetics. And then ours is the master's in genetic counseling. So when you're in the Rackham application, just make sure you're choosing the one that says genetic counseling, not the other 2, if you in fact want to be a genetic counselor. Nina, I think we're probably going to be taking between 8 and 10 students, and we will be taking between 8 and 10 students. I don't know if it's going to be 8, 9, or 10. And it's worth mentioning that the reason why we're careful about the number of students that we admit is to make sure that all of our students have really quality clinical training experiences. And so it takes us time to kind of do a good hard look at what's happening at all of our clinical training sites to make sure that we're being responsible in terms of the number of students that we're admitting. So it will be between 8 and 10 students. Okay, I think we can go to the next slide. I wanted to make you guys all aware that we have a pretty comprehensive document on our website that's a PDF document called our program prospectus that should include all of the information that you need to know about how to apply to our program. It's also on our website on like lots of different tabs that you have to click. But if you're someone like me who likes to have it all in one place and maybe even to be able to print it and highlight and stuff, this document should hopefully be pretty helpful for you. A couple of common questions that come up related to admissions is related to our prerequisites. So in terms of coursework, we require science courses up through and including biochemistry. So that does not need to include a laboratory component, but it does mean that you need to take organic chemistry. When we say up through and including, if you're taking a biochemistry class that's like designed for scientists, science majors, then that's going to require organic chemistry. We also look for an upper level human genetics course, typically 300 or 400 level if available at your institution. If that's not available at your institution, you can reach out to us with maybe a syllabus or some ideas about what is available at your institution, and we can help you think through 2 things. Number 1, does it meet our prerequisite requirements? Number 2, even if it does meet our prerequisite requirements, are there other classes that might help you be even better prepared for the genetics coursework that you're going to take here at the University of Michigan? We do require a general stats course, and we do not require psychology, which I know a lot of other programs do, but we do not. Moving away from coursework, we require advocacy work. We don't set a minimum amount of time that you need to participate in that. We're really looking for you to get involved in some sort of activity that allows you to put yourself in the role of helping somebody through a difficult situation or a difficult decision and being able to sort out, is this the kind of role that you want to play within your career? So when the question comes up, does this count as advocacy work? Does that count as advocacy work? I really challenge you to think about, is an experience where you are being forced to help people through difficult emotions, and gaining some awareness of how you feel about that. And then finally, we also think it's super, super important to have exposure to the field of genetic counseling. That can be through shadowing, but it can also be through things like attending webinars, talking with genetic counselors about the work that they do. While we think it can be really, really valuable to participate in shadowing, we know that depending on where you live, there may be limited opportunities to actually shadow a genetic counselor. But I do think that there's lots of new and innovative things out there in terms of webinars and other ways, podcasts, et cetera, to learn about the field. So we look for that in your application. And actually, let me just say one more thing about that. When I say we look for that in your application, we don't just look at your CV to say, or your resume to say, oh yes, they have advocacy work. Oh yes, they listed 10 genetic counselors that they spoke to. It's really, really helpful to use your essays, or really, really important to use your essays to actually show what you've gotten from those experiences. So it's less important that we read what the list is, and more important that we read what you have to say about what those experiences were. Okay. We are not requiring or reviewing GRE scores. It's kind of old news, but we just want to make that sure that everybody's aware of that. We require 3 letters of recommendation. We used to require that one of them needs to be from your advocacy work, but we don't require that anymore. Just need 3 letters. I recommend that they come from people that know you well and who can talk about your passion for genetic counseling and why they think you might be a good fit for it. Make sure that the people that are writing your letters know about why you're excited about genetic counseling. And then the other thing, as it says here, is that all of our interviews will be virtual. No in-person interviews will be conducted. So hopefully that is helpful information to know. We use a holistic review of applications. So what does that mean? It means that there's not one aspect of any application that is going to disqualify somebody from admissions. Like, we don't have a GPA cutoff. And there's also not just one thing that will automatically get you in. So even if you have, a stellar GPA, we need to look at the whole package. So we're looking for people that are passionate and knowledgeable about the profession, and who have an ability to share something about themselves, and their passion for genetic counseling in their essays. So those essays are super, super important. We look for appropriate advocacy experience, as well as the ability to reflect on it in the essays. We do look at what your academic preparedness looks like, including both your GPA and also your transcripts as a whole. So we know that not everybody has a linear path through undergrad. So it's not really just like the GPA that matters, but how did you do in science classes? Did your grades go up or down as you made your way through college? I mentioned the letters of recommendation. We're looking for people who have strong communication skills, both in writing, so that's in the essays, and then when we get to interviews, in the interviews as well. And the other important part of holistic reviews are that each application is reviewed by multiple people so that we can get multiple perspectives on an application. I mentioned that we're an in-state, I mentioned that we're a state institution, and we do not, however, have any kind of quotas in terms of in-state versus out-of-state students. So we do not consider residency as we're considering applications. Everybody's kind of on a equal playing field for that. And finally, we do strongly encourage reapplicants. So every year we have a really sizable number of students that match to our program where this was not their first time applying. So we actually look at students applicants who reapply, this shows that you're committed and that you're passionate about the profession. So it's nothing to be ashamed of. I would tell you, just embrace it and to write about it in your application in terms of how you think you may have grown from the year prior. Okay, are there any questions? Let's see here.
Looks like we have one question about letters of rec. Are you allowed to submit more than 3 if you have supplemental letters of rec you want to think about?
We really only accept 3. We have so much reading that we're doing across applications that we really do need to limit it to 3. And if the biochemistry course that is online is offered through a degree granting university, and you take it for credits, then we would accept it. It's okay if it's condensed over an online course.
All right.
Okay. All right. Yes. I'll hand it back to you, Beth. Then I can cough.
Okay, so we're going to hand it over to the students actually. So we have our 2nd year Emma and our 3rd year Amy joining us. And I think Abby was going to address this question too, but they're going to give you some tips and advice for applying to GC graduate programs and introduce themselves as well.
Yeah, we can go first. So my name's Amy. I'm a 3rd year dual degree student. So I am doing a degree in public health and health behavior health education in addition to the Master's of Science in Genetic Counseling. So one tip that I really encourage whenever I get the chance to talk to students is to continue to ask questions. You all are doing the right thing at this point in the application process of going to these informational sessions and sending emails and talking to students and leadership, but you're going to continue doing that with other programs too. And whether it's something that we're mentioning tonight that you're really interested in and you're not sure if other schools are, you should ask them, and vice versa. If you're going down the line talking to another school and you're like, I wonder if Michigan has that, please reach back out. This is not the only time to get this information. I think when I was in your shoes, I was super anxious about bothering leadership with a million different questions, but that's why we're here. And our students are always willing to chat with you. And I think it's just helpful on your end of what schools to apply to. And then once ranking comes, to know what schools to rank. So don't be afraid to circle back with programs multiple times to get those questions answered.
Hi, I'm Emma. I'm a 2nd year student in the program. I would say, echoing everything that Amy said, but also, we see that long checklist of like prerequisites and things that you need to do to submit. I think it can be easy to get almost sort of lost in all that you have to do. But I think also like remembering in personal statements and your interviews, like your own unique story and everything about yourself and what you're bringing beyond just what can be, seen on a piece of paper, and not being like afraid to demonstrate parts of yourself and your story that go beyond just that you've done all these things and checked all the boxes, but like, why are you interested in this profession? What do you like hope to bring to a program or the field or the community? Not just talking about all of your amazing accomplishments.
Yeah, kind of going off what Emma said, I think the essays are really one of the most important parts of your application, because it really gives the people reviewing your application to get to know who you are before actually interviewing you. So really focusing on editing those essays and making sure that they really convey all of what you want them to convey is really important. For me, a helpful resource that I found was at my undergraduate university, they had a Center for Career Opportunities, and they had different individuals that I could connect with to review my essays and also give me resources on how to prepare for interviews when the time came. So I think that was really helpful and is worth looking into if that's available. There are also a lot of online resources that are really helpful too. And then also something else that was really stressed to me when I was applying was don't get discouraged if you don't get in on your first try. Because I was a reapplicant and got in my second time applying. So I think that's really important to remember just moving forward. Even if you don't get in, don't get discouraged. Because this is a really competitive program. So
Thank you. Yeah, Abby, a really important point. Amy and Emma, can I put you on the spot to share a little bit more? Because when we had the question come up, Rose did a great job, but being only a first year, it might be good to hear from second years and third year as well about what you really like about the program.
You want to go?
Sure. I think what I really like about the program is how I feel consistently strong it is across all three areas of like the classwork that you're taking that is, you know, at quite a high level. It's also with PhD students who are in genetics and taught by leading faculty in genetics. And research, which this program takes quite seriously, and you get to really develop yourself from whatever your interest is starting the first year to clinical sites, you know, when they're affiliated with the University of Michigan, which I personally have had like really great experiences with. So just sort of getting that consistency across those three main like aspects of the program is something that I have really liked.
Yeah, I think one thing for me has been various aspects of the program that contribute to this, but really the structure of being in clinic early was something that I didn't really know the difference. Like I know different schools do it differently of when you're first in clinic. So for our students, we're in observation rotations the second week of training. And I didn't fully appreciate that until a little bit further in my training where I could be in class, learn a concept, go into clinic that week, see it happen, follow that up with peer supervision where I'm talking to my classmates about it, and also have an open door policy of leadership where I'm constantly just going to their offices and being like, oh, I had this random thought about a case or random thought in the middle of my day. I'm here to process it. So I do really take advantage of a lot of the opportunities to interact both in the classroom and in clinic and with leadership to really immerse myself into our training because it is such a skill development approach. And I think that's really different from undergrad where it's more of like that achievement and checking boxes and exams. Like graduate training is just very different than that. And so I think the structure and the level of support that we have has been really helpful for me. And that's something that I really enjoy.
Thank you. Thanks for giving us that little bit senior student perspective. And Abby and Rose, thank you for answering questions earlier. Thank all four of you for coming after a day of clinic and classes and everything else. So I think we just had a few more slides here, which are mostly resources, which you probably are familiar with the majority of these, but I am going to send out the slide deck tomorrow along with an evaluation of the open house. Very, very brief, but it would be great if you wouldn't mind filling out the evaluation so we can continue to improve. And in that email, I will also share the slide deck here so you have this list of resources. Just a quick note, advertisement to let you know the Michigan Association of Genetic Counselors, or MAGIC, is hosting an event for prospective students on November 1st, and you can register. Again, I'll have that in the email if you haven't already. And then a few more ways to find out about student life here at University of Michigan. And then Monica mentioned some additional resources or places where you could find out about funding your education, and those will be shared as well. And I think that is it for our slides. I'd like to open it up for any final kind of questions in our last few minutes here. I think we probably are okay to unmute, but I'm watching the chat as well. So I'll throw out this one to Lauren. I don't know if this is aimed at program leadership or to the students, but what is your favorite characteristic of the program that might not be gleaned from the website or this presentation? So it sounds like maybe to the students. Anything else? Any other favorite characteristic of the program that wouldn't be on the website or this presentation?
Beth, I want you to answer that actually too.
Do you want me to answer that?
Yeah, I'm so curious actually.
Well, I have numerous favorite characteristics, but I think I'm going to take it from my point of view and say again, I feel extremely, extremely fortunate to have this program built on the community that we have. And I'm thinking in my hat a lot about the community of genetic counselors here at Michigan Medicine and the supervision and support of the program that they provide. It sounds cheesy, but it really is true that they have a vested interest in the students they supervise and really want to see students succeed. So I feel really fortunate that that is a strong characteristic of our program. Is that what you thought I'd say, Amy? What did you think I'd say?
I don't know, actually. I just think it's interesting because you all get to talk about the logistics, but there's so much more to the program, which I'm glad that's why this question was asked.
Yeah.
But I'm going to let Emma answer as well.
I was gonna say from a student perspective, I like really appreciate, and I know this ultimately comes from the program. Like the program is very invested in us as a class being like close and doing things together, and there are traditions that have existed in this program for years and years, all about like us doing things together. So for example, there's cabin weekend in the spring semester when all the students, first years and second years, all go to a cabin for the weekend and spend time together across different classes. And that's just something that is like a really big part, I think, not just that individual event, but the culture of this program is really centered on like building that student community, which is something I really like, and I don't think it's on the website or anything.
Add a cabin weekend tab to the website.
Cabin weekend doesn't get added to the website unless we ever get invited, right? No.
We'll see. We'll see.
We actually do have a different kind of cabin weekend, which is our departmental retreat, which is coming up this coming weekend, which is a more formal kind of coming together of our entire department. But I think that's also sets a nice kind of precedent for the rest of the academic year of the department coming together. So let's see here. Other questions?
Amy, how do you feel about gaining a dual degree?
Yes.
How will this improve your skills as a future genetic counselor?
I was clapping because I love dual degree questions. So I will say that every dual degree student approaches that very differently. So even the three of us that are third year students in the dual degree program are in it for very different reasons. So anything that I say doesn't necessarily have to reflect your story. But I think one thing that's been really beneficial for me is being able to apply these public health concepts and the perspective when thinking about patient care. So we're doing a lot of individual level or family level care with the genetic counseling program. And I think that it allows me to be a bit broader. Oh, no. Okay. I think it allows me to think a little bit broader than that of like the community level or even broader than that. So just thinking about how our counseling is impacted at all of those different levels rather than just that one patient interaction that we're having. And so I think that that will impact my skills in clinic. I think it already is actually. So the dual degree program, I'm sure you talked about this a little bit, but the second year of training is mainly in your public health year and the third year is mixed. And so now that I'm back in this mixed space, I'm being able to see how that public health mindset is impacting my counseling. And I think in the future, it's going to allow me to open some more doors to other opportunities as well. Like if I want to serve in different roles or serve on committees, I think having that public health mindset will be an asset in those spaces. I do like to give a lot of caveats when I talk about the public or the dual degree program, because one, you can always take public health electives. And you can always do a certificate program. And I do recognize that having an extra year of training is a large privilege. And there are a lot of folks that really desire to have this experience, but for many reasons, whether that's financial or family or other life things, they aren't able to dedicate that time. So don't think that you have to do a dual degree program to have this experience. You can still be on committees and think about all the layers of community and higher, just taking those classes and having that experience. That's my short answer.
Great.
All
Amy,
right,
there's actually a good one. Oh, sorry, Monica.
I was gonna say that there was a question here about whether we have a LEND program. So genetic counseling students can apply to be a LEND fellow. And Amy, who does a lot, was actually just completed the LEND fellowship. So I'm gonna hand it over to Amy to talk about that too.
Yeah. So there is a LEND program here. It does function a little bit differently than other LEND programs, so be sure to keep asking these questions if you're looking at other programs. So the Michigan LEND program is across multiple institutions across the entire state. So it still does focus on the interdisciplinary work of working with other professionals, but it also is across institutions, which I found to be really valuable because we're at a large academic center and have, again, a lot of privilege and expertise here. And so it's interesting to think about how folks at other institutions in Michigan are being trained and their experiences with their communities and populations that they're more close to. So it is very demanding, I will say. It's a lot of hours. It's 300 hours collectively across didactic, clinical, and kind of an optional bucket. So it does take a lot of time and effort, but I would say it is well worth it. I feel like at least weekly, if not multiple times a week, my LEND training is coming up and applicable to conversations that I'm having in class or clinic or even with my research thesis. So I did really enjoy it, and I'm happy to kind of chat more about the logistics and that experience as well. My email's in the chat.
Thanks, Amy. I think there's two kind of related questions here asking Abby, and I think Rose too, working as a genetic counseling assistant. Can you talk more about this experience and how it contributed to your experience now as a student? And then a second question from Katie, for the students, what experience prior to grad school was most helpful to prepare you, gave you the most transferable GC skills? So we could kind of combine those and talk about work as a GCA before becoming a student, or really any experience where you had skills that help prepare you for GC school.
I can start us off. So I think both my advocacy experience as a hospice volunteer and then working as a GCA really helped me develop skills for how to talk to patients. I consider myself to be a little more quiet, so really kind of putting myself in those positions helped me to develop those communication skills and to relay that information on to the care team or to the genetics team.
I can go next. I really enjoyed my experience as a genetic counseling assistant. I think that was most helpful, I guess, in preparing me for graduate school. Like Rose said, it involved, my position at least, involved a lot of communicating with patients and also doing other tasks that genetic counselors would do, like writing letters and taking down pedigrees and things like that. So those were kind of direct skills that you'll do as a genetic counselor and learn in this program that I was able to kind of get accustomed to ahead of time, which was helpful, I guess. And then I also volunteered with the crisis text line, which similar to what Rose said, I also consider myself more of a quiet and reserved person. So that experience really helped me kind of dive into having hard conversations with people and I don't know, interacting with them in that way. So that was also something that was helpful for me.
Thank you, Abby. I see a couple of questions that I see as kind of related, or maybe they're not, but I'm going to make them related. So one of them is from Emily. Can you share the biggest strengths you see in your current students? And I think that that's a hard question to answer because they're each individual. So I can tell you how I feel about what Amy's strengths are and what Emma's strengths are and what Morgan's are and Abby's and Rose, but we're really not looking for like identical students to each other. So yeah, so I think that each person is an individual. And so I can say they're all motivated, hardworking, passionate about genetic counseling, but they all have really unique strengths, which I think also relates to the question that Lauren asked about what do you find the overall commonality there is between students and faculty within the program, and programs foster a well-rounded and diverse group while balancing students who share some core values. Again, I'm not sure exactly if I'm answering this the right question here, but again, we're looking for people who are excited about genetic counselors, who about becoming a genetic counselor, who are willing to put in the work, who are you know, able to express empathy and be caring and supportive. But there's not, I would say, like, again, one cookie cutter of what we're looking for. In terms of like common values, we've actually we did put together something recently, a task force of guiding principles related to how we at least think about diversity, equity, inclusion, and justice in the genetic counseling program. I can maybe, when I'm done talking, put the link to it in the chat. But so I don't know if I answered any of those questions other than to say, like, we're really looking for really unique perspectives, and but people who care about the patients that they're going to serve and making a positive impact on patients and society. So lots of questions. Sorry, I'm just scrolling. Okay, so thank you for putting the guiding principle link there. Are there questions that haven't been answered yet? Oh, there was one about, I forget what the term was used. Do we pay attention to interest in, hold on a second. If somebody knows the question I'm talking about, it was like
Demonstrated interest, was that taken
demonstrated
into
interest.
account in applications?
Again, I'm not sure exactly what's meant by that. To me, that seems a lot like an undergrad type of approach. So we are not necessarily like tracking who comes to visit, who had football tickets last year. I don't know what undergrad institutions, how they think about that, but yeah, we do. If in your essays, you know, we had somebody one year who talked about how much they can't wait to move to Lansing to be a University of Michigan student. And I'm like, well, that's not even the right city or the right university. So that didn't work towards them or for them. So if in your essays you say something about why you're interested in U of M specifically, that's certainly not going to hurt. But I don't know. I'm babbling a little bit at this point.
Yeah, I think
Do
sometimes.
you have anything to add?
Yeah, I think, like you said, there are some undergraduate programs that definitely tag like who attends an open house, who attends these different events, and we don't do that. Now, do we take notice? Are we aware when in the application, you know, does it become clear that people who know more about the Michigan program? Yeah, sometimes those things become evident, but we don't kind of track like demonstrated interest.
I don't think that most graduate programs do.
I don't think so.
That I know of. Okay, if somebody has a question in the chat that we haven't answered, just go ahead and unmute because there's a lot there.
I think we've covered a lot of them. The one I do see is what's the most unique part of your curriculum that allows students to succeed in the future as practicing GCs that may be different from other programs. So I don't know, Monica, if you want to answer that or think about that.
I don't think that there's any one class. I think it's really the culmination of as I think it was Amy, or no, actually it was Emma who said, thinking about the different types of classes and the different experiences that all kind of come together. I think we have, I think we're very balanced in terms of what our curriculum looks like. So we've focused a little bit on the human genetics coursework and how rigorous that is, but at the same time, our students are also working throughout training on their counseling skills, starting with the very basics and working on to more advanced skills in their second year, learning together from both genetic counselors and also social workers and psychologists and other people across different disciplines.
Emma and I just ended our class in social work, our death, loss, and grief class. So that's why we're a little bit late. But I think that's a good example of one class that technically is a requirement for our curriculum, but still allows us to interact with others in different disciplines. So.
All right. Well, we are after 6:30, and I think we've hit most of the questions. I did put in the chat the email if you have questions following the open house, and I'll do that again. You can reach out to us at this email if you have any other questions that come up, and I will be sending the slides out in the evaluation. So look for those in your email. All right.
Yeah,
Thanks
thank
again.
you.
Thank you all for coming.
And thank you to our current students for
Yes.
chipping in with this. We appreciate it.
Bye, everybody. Thanks, guys.